And yeah, so I sat for the exam in November 2022. It was face to face. Yeah, and I did pass it the first go as well. Yeah, so I started preparing probably about 3 months before the exam. I think it's just starting to prep in terms of looking for what materials I needed, going through the online resources. But I think it took me about a month to gather all the resources. And I think just in terms of actually sitting down and doing serious prep, I would say about 2 months before the exam. And obviously a bit of reading and lots of role playing involved. Yeah. Um, Honestly, the one of the biggest challenges initially was trying to find the resources or the reading materials that you needed because it's not very clear and it's quite vague online as well. If you try to look for resources online, there's no one particular place where you can get everything, and a lot of people say lots of different things. And I think it was quite easy to get lost in the whole process of trying to find what's the best thing to use to study for it. I think that's why I was quite happy I met Aaron because he really narrowed it down as to what I needed to focus on, what materials I needed. I think the other challenge would have been trying to find a good role player to essentially do role playing with, because obviously studying and reading you can do by yourself, but in the clinical exam, obviously you need to have someone to be able to practice those skills with. I was lucky I got my partner to help me out with that as well. So she's not from a medical background; she's just a chemical engineer. Um, but obviously, you just need a patient. Basically, you just need someone to simulate a patient. So um, I think, yeah, I think initially, obviously, it was quite tricky because to show her exactly how to do it. But after a couple of goes, she got the hang of it really fast, which was really lucky for me. And yeah, she definitely helped a lot when she started to be good at being a simulated patient. And obviously, Aaron's showed me how to do it. So I think those were the two main challenges I had while trying to prep. For the face-to-face exam, I think the only difference between the online exam is obviously you're there in person, so try and look smart. Be comfortable, be confident, but obviously not overconfident. Practice sessions as though you're doing an actual exam. Like for example, if you're gonna wear say a shirt and pants, wear those exact shirt and pants and role play. Obviously, for the face-to-face exam, we need to wear a mask. So wear a mask as well. Try and get as close to the actual exam when you're simulating and doing role plays. And yeah, that's the next thing as well. Do like lots and lots and lots of role plays because ultimately it's like, yeah, the knowledge is important, but I reckon like for myself when I was studying, I've kind of focused more on just being smooth, being clear and coherent, and having good bedside manner. Those were the things that I tried to emphasize a little bit more during the exam. And of course, the knowledge. If you've been practicing medicine on a daily basis, it just comes, as you go. So definitely just focus on the soft skills. Just being clear and making the patient comfortable as well, because the examiners do take feedback from the simulated patient as well. Yeah, I did a mock exam with my partner, and she kind of helped select 16 questions based off the list we had, and yeah, we set up a room as well, which I will go in and out of to obviously complete the station. And I think it was really good to do the mock exam because it helps you to manage your time as well. Because 4 or 5 hour exam sounds like you can go through it, but when you actually sit down and do it, it's actually quite tiring. So it's good to go through it at least once you understand it. You can manage your time and manage how tired you are as well going through the stations.